Universal Healthcare by me, Andrew Werner, Hayden Horn, Lisa Miller, and George Coker. So here's some context on universal healthcare. Today in America, universal healthcare is one of the most heavily discussed topics in the media and in politics. The U.S. has a rather unique system for healthcare for its citizens. The best way to describe it would be to say is that it's a hybrid system. Healthcare providers are largely privately owned businesses in the U.S. According to the World Health Organization, 58% of community hospitals are nonprofit, 21% are government-owned, and 21% are for-profit. Since healthcare providers are mainly privately owned businesses, that means that they are trying to get a profit from their buyers. But the price of healthcare in the U.S. is incredibly high, and many lower-class citizens cannot afford healthcare. ABC News estimates that about 1 in 5 U.S. adults cannot afford healthcare. This equates to around 40 million American adults. This is why so many people desire a universal healthcare system in America. Okay, the problem. Universal healthcare requires too much money and resources for taxpayers and the government. Contrary to popular belief, a system of universal healthcare is actually more expensive than the U.S.'s current system. The reason for this is that when you pay for universal healthcare, you're paying for quality. Another reason is that privately owned healthcare providers have high prices is because they provide healthcare in a far nicer standard than government providers would be able to. In order for a system of universal healthcare to be able to keep up with the quality of privately owned healthcare providers, the cost of universal healthcare would go way up. If the price of universal healthcare were less than the price of privately owned providers, then the quality of healthcare would decrease significantly. We can see the decrease in quality in places like Canada, where the wait times for emergency rooms or clinics is outrageous. But there needs to be a way that the U.S. can solve this. There are far too many citizens that cannot afford healthcare, which is why a universal system is necessary.
So one solution to this problem would be to have the government use the money that we are using right now for the Affordable Care Act and pay that to health insurance companies, so that would cover half the cost of what people pay for their health care. That way it's much more affordable and it's not run by the government, so you still get the quality levels of the private healthcare insurers. And one of the pros of this is that the costs are cut in half for both the people and the government, because the government only pays for half and the people only pay for half. So this is a way in which you can have a compromise between government and the people and who's going to pay for what. And then another pro is that this affordable healthcare will help keep the citizens healthy, so it won't cost the insurers as much to pay for these people's expenses, so that way the price can still keep going down because we'll have more healthy people. One of the cons is that it doesn't completely pay for everybody's health care, so there might still be people who can't afford it, and those people would have to find a way to either have health care or they would have to go without health care. So that's a big problem with not having a full universal health care system. Some of the limitations to this is that the insurance companies might just say, oh no, we don't want to agree to that plan because we want to have these rates right now. But that's unlikely, because if the government is paying for half, they're going to have more people who can afford health care, and that will give them more customers, so that they would likely agree to this plan. And the implication is that more people can afford health care and have it for a lower price, and death rates will go down. We'll have a bigger workforce because we'll have more healthy people living into their older years. And some evidence that this would work is that last year the U.S. spent $940 billion on Obamacare, or the Affordable Care Act. And if you redirect this money to the insurance companies to pay for half of everybody's health care, that would really cut the costs. And on average, a U.S. citizen spends about $4,358 on health care per year. So if you cut that in half, that's all the way down to $2,192 per year. So that way that's a lot less expenses that they have to pay each year for the health care, so more people can have it. And again, insurance companies are going to get more customers, so they're more likely to agree to this than they are to disagree with it. And the average income for an American is about $74,000 each year, and so this healthcare is only about 3% of their average yearly income, compared to the 10% that they spend, that the average American spends on healthcare now of their average income.
We all know that the Veterans Affairs hospitals are not perceived as their best medical facilities, and we all have heard stories about the wait times for our servicemen and women to get needed medical attention. So while there are disadvantages to the solution, the advantages are far greater. The reality is that the VA hospitals and bureaucracy within the VA system do need to be improved upon. The VA is actually the largest free healthcare system in operation, and is actually a very efficient medical system according to Time magazine. Other advantages to the solution are the fact that the VA operates on a much more limited budget than universal healthcare. Also, using the VA system would allow insurance companies to continue to operate, which is economically beneficial to those employed by them and those that indirectly benefit from them. Medical services provided by the VA are also a higher caliber than most medical facilities globally and much better than public perception suggests. For example, the VA addresses some of the most difficult physical therapy challenges in mental health. The fact remains that it is easier to edit an existing medical system than it is to create an entirely new one. Therefore, it is presumed that economically it will cost a lot less to edit one system than it will to create another system. Those who oppose this idea point out that the increase in taxes if we go this route is far less than paying for a new healthcare system. We found with Obamacare or universal healthcare, starting a completely new system is a multi-billion-dollar endeavor, and the cost of continuing to skyrocket since its inception. The intentions behind universal healthcare are good. It is assumed that a country with the wealthy United States should be able to provide basic medical care and services to its citizens. Unfortunately, the implementation of universal healthcare is a problem issue. Since implementing universal healthcare, the insurance companies have started to fail. While there would also be the added benefit of allowing the convenience of insurance companies, the real benefit is the ability to provide affordable healthcare to those in need. Ethically, to improve upon and then expand the existing VA system provides a good end result. If we can expand the medical services to not just veterans, but also those in social economic classes that need it, and to other groups of individuals, such as those with pre-existing medical conditions, so that those who are truly in need of healthcare can receive it, and this is the ethical idea.
So, in conclusion, universal healthcare has become an increasingly important issue in the United States. Last year, half of the Democratic Party's funding was spent on advertisement for a healthcare reform. The main problem with universal healthcare, as said by my fellow classmates, is not whether we should have it or not, it is whether we are willing to spend the massive amount of money to implement it. Our group came up with two solutions for this problem. One being taking money from private companies, and the other being a modified VA system. Although there is no perfect solution to this problem, we ended up coming out with the modified VA system as the better choice. Overall, it has less cons, and although it causes a slight increase in tax, which might make it unpopular among voters, it really helps the people who need it the most by having lesser wait times and a higher quality service. The other reason we chose it is because it would be easier to implement. We already have a VA system, so it wouldn't be a big change to make.
Good, your time was 8:40, so now I got a couple of questions for you. So we'll just go from left to right, okay? What was the strongest counter-argument to the solution that your team identified? And you can pick either one of them, but what do you think is the strongest negative of either one?
Okay, so for our first solution, where we give half the money that privately owned businesses would use, that would actually draw out more contrasting sides for the lower class and higher class systems. So the higher class people would be able to pay for this much more easily than the lower class people. So it would seem rather unfair for the higher class people, but that's just kind of the way it is.
Moving across, Mason, describe an argument from one of your peers' individual reports that made you think differently about your final conclusion overall. So did any of them have a perspective or an opinion from one of their pieces of evidence that changed how you feel?
I really liked Aiden's argument because it really brought in universal healthcare as like a financial issue. It wasn't because like I was always really wondering like why don't we have it? It seems like the right thing to do, but Hayden made it seem his argument. It really opened my eyes to how much it would cost and how much money it would take to really make it.
Good. And then Hayden, having finished the project overall, do you consider that you guys had any holes that you would like to fill, like to be more certain about your conclusions? Do you think there would be more research you would do, and if so, where would you get?
I think that if we had more time for this, we would have really analyzed the exact cost of putting in a VA style system for all Americans. So we'd probably find that through some government websites and maybe some not like opinionated, but like economist opinions on how much it might cost to implement that system. So definitely to like certainly find out how much it would exactly cost so we can determine if it's economically and ethically feasible.
Thanks. And then George, how overall did you guys change from how you started your presentation discussion to where you finished up? Can you kind of tell us the story of that?
So when we started our presentation, we focused a lot on Hayden's lens, which was the economical lens. We had a lot of stuff about the costs of different solutions to universal healthcare being too expensive in our report. And then we changed it to be more of the ethical lens, which was Mason's report, and put more stuff about how like different solutions would help more people or less people instead of how much they cost.
Okay, perfect. Thanks, guys.